whatever you do, be the GOAT. If you listen to them, present time consciousness. Patients want to know how much you care before they care how much you know. Why are they coming to see you? So 98% of new patients have been to other doctors before. So they come to see you. It's not like they've never seen a chiropractor. They've always seen a chiropractor, but they're looking for somebody who probably has a different technique, because the other doctor maybe didn't listen to him. So now they're going to go find somebody else. So, but once you can get these results and you know everything that you need to know to help your patients, they'll never leave. Sometimes when you listen to somebody, you're thinking, what the heck does he know about anything, right? Well, I don't know anybody who's had over 1,000 new patients a month that would come into my office, and they had to have a pain level of 5 or above. And so we would probably average around 300 new patients a month in a clinic. That was when I had 75 employees, and it was all 100% insurance. So what I'm going to tell you today are some things that we did to maintain happiness and patient satisfaction. So maybe if you just take one thing out of here, I hope it can help you with, building your practice, retaining patients, and having what we call raving fans, right? And so let's get into this. So how do we have raving fans? Well, you know what? Make sure they're scheduled right. The worst thing is you have a patient that, that comes in when they're not supposed to come in, and then you want to have a proper follow-up call and reminder from a staff person. So we do calls the day before, and we even have a software that lets them know that morning of a text. But also Proactive has a software where they're also reminded. Sometimes they can be reminded too much. If they're getting 2 and 3 or 4 reminders, you need to kind of weed them out and do the ones that, because if they get too many calls, we've had a few complaints where, all right, already, I know I have an appointment, so there's a fine line there. Some people need a lot of reminders and some people need one, so we just have to kind of play with it and find out what fits your office. And then the front desk staff person should be cross-trained on everything. So, I do this coaching on weight loss, neuropathy, diabetes, and pain management. So I'll call an office from one of our doctors. We've trained over 2,500. I'll call an office just to kind of check on them. And I asked the front desk person, so they're supposed to be doing weight loss. So I asked the front desk, so do you guys do weight loss in your office? She's like, I'm not sure. I think so. Wrong answer. So obviously she's not trained with, let me think, anything. So then I talked to the doctor and said, did you know that your front desk doesn't even know you do weight loss? Oh, well, she's new. I go, well, first of all, you shouldn't let anybody loose on the front desk until they've been trained on everything that you do. Because that first call is either going to be a win or a lose as far as getting a patient scheduled. What if a patient calls in and says to a chiropractor, hey, can you guys handle, sciatica? And she's like, I think I've heard of that. I don't know if we treat sciatica. We're just a chiropractic office. See what I'm saying? So you need to train these staff so they know everything. So that's why you have weekly staff meeting. You have weekly staff meeting, train your staff. And you shouldn't even let a staff person near the front desk until they know every position. Okay, very important. So when they get there, when the patient gets there, even if it's 10 minutes late, make them feel amazing. So you got Bob scheduled for 10 o'clock. So anyway, so we're going to go in and you're going to look at the calendar and you go, well, here's a guy that just came in, Bob. He looks like he's 50 years old, so he's probably a Bob. So you go, hey, Bob, how you doing? Good to see you. We're so glad you're here. You're going to be right 99% of the time. And it's going to make him feel amazing. Okay, remember the rule of 2s. You always want to say their name twice. You just said his name, welcome, Bob. And then another staff person is going to know, hey, Bob's supposed to be there. You walk down the hall to the exam room because you're going to do something called the value tour in just a minute. We're going to show you. And then Bob's going to feel like, wow, these people already know me. I like this place. So don't just give them the paperwork, say, here, fill this out, because that's what most offices do. And that's annoying. Every time I go somewhere, here's some paperwork. I just want to take it and chuck it. So you know what? Screw this. You guys have no personality at all. And of course, they're usually a medical office, right? So the front desk should have a backup. And used to have these headsets, like you see at like Old Navy, so you can call and talk to everybody in the office. So you can get on the little headset and say, hey, I'm going in for new patients here. I need a cover. So then somebody, therapist, will come up and cover the front desk to answer phones. So the front desk person will now go around the desk, take the paperwork and sit down next to this person and say, now the doctor wants you to fill this portion out because he's really interested in your past history. And this is going to be this. So you kind of explain everything on the form that the doctor wants you to fill out. And this makes them feel really important because they may not know what all this is for. You know, if it's just a bunch of blah, 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 or the doctor really wants this because he wants to know more about your history so we can really focus on how to help you with your condition. And then after that, you give them a value tour. You show them all what you do because you just don't go to the exam room. You want to show them all the cool things. You know, maybe you have a big decompression table. You know, maybe you got a good therapy suite. Whatever you have, show them around the office in a manner of a tour before you get to the exam room. And then also on Wednesdays, we do shakes. You know, we do these shakes. We make shakes with the different flavors from the company we use called Solutions for. And it's just really great. It's almost like we're Costco, you know, on Wednesdays, you know, giving out these samples. And people love samples because I'll tell you what, 9 out of 10 of them, you give them a sample, they go, oh, hey, I'm going to buy some of that. Do you guys have that here? So you're going to sell a lot of that. And you get patients on these nutritional shakes with prebiotics, probiotics, enzymes, protein coming from New Zealand, lactose-free, casein-free, you know, so it's dairy-free. And again, they become raving fans of what you have in your office. All right. Now make sure to listen to your patients. The best way is to look in their left eye. You look in their left eye. And studies have shown that looking in their left eye, they feel like you're really listening. Imagine that. I have a doctor that came to a training. And this doctor even went to Tony Robbins training. He like certified Tony Robbins, whatever. And he could not sell a program. So what I do is I have the doctors record their history, you know, talking to the patients, the report of findings kind of a thing. And then they send me 2 or 3 of these recordings with patients there. And this guy would just talk. He never let the patient talk. And I thought, no wonder he's just vomiting on all these patients, you know, with words. Telling the patients how cool he was and all the things he's done. And I just thought, dude, you haven't even asked them what's going on with them. Let them talk, you know, let them tell you what's going on. We had another doctor who had poverty mentality. You know, oh, I'm in a town. People here can't spend that much money. People here would never spend that much money. So I'm like, you know what? It's not chiropractic. Yeah, they're going to moan about a $10 or $20 copay. But I was telling them about the weight loss program. Oh, I could never ask anybody to pay $2,500. That nobody in my town has that money. So I said, oh my gosh, try it. Just try it. So this lady wrote him a check for $2,500. This was a couple years ago. And he's like, this lady has always moaned about deductibles and copays, but she was excited to write out a check for weight loss for $2,500. I can't believe. Oh my gosh. So now his head or his comfort and everything is no longer poverty mentality because he's no longer thinking that way. Okay, so I hope this makes sense. Now, see that you have helped many before them. They're not the first patient. So educate them as to why they have this complaint and show testimonials of patients that you have helped before with the same condition, whether it was, you know, pain, back pain, neck pain, whatever, neuropathy. We do a lot of neuropathy, diabetes, weight loss. So whatever it is that they're in for, I have a screen on we have a website that has a lot of testimonials. So I have a lot of different ones to choose from to show them because I want them to see, hey, this program works and it's helped people like you before. Whatever you do, be the GOAT, you know, because you want them to, if you listen to them, you know, present time consciousness, you know, they care. Patients want to know how much you care before they care how much you know. Why are they coming to see you? I mean, just look at that lady right there. See her staring at that patient. She really cares. Her head's tilted a little bit. And she's like really genuinely wanted to know what's going on with this guy. So 98% of the new patients have been to other doctors before. So they come to see you. It's not like they've never seen a chiropractor. They've always seen a chiropractor, but they're looking for somebody who probably has a different technique, you know, because the other doctor maybe didn't listen to him or didn't address their concern or didn't help them because they didn't know really how to decrease swelling inflammation in the discs. because the discs have a microbiome like the gut. So if you don't help and heal the gut, you're not going to heal the disc. So now they're going to go find somebody else. So, but once you can get these results and you know everything that you need to know to help your patients, they'll never leave. Remember, it's about them, not their money yet. Depending on what services you offer with different therapies, let them try it. Let them try it for a visit or two. I was talking to a doctor Monday, and he said, no, we basically go over pricing. We go over everything. And he has a hard time selling programs. We go over pricing. We go over everything before he even gets a treatment. It's like you want to have them pay for you go in to buy a car. You can't test drive a car. You have to pay for it, and then you can test drive it. No, people go and they test drive a car. Okay, back in 2003, no, it's 2000. Yeah, 2003. I went and I bought the first Escalade ESV, the big suburban size one in the state of Utah. And I went there and the guy said, hey, yeah, take it for an hour. See you in an hour. I don't need to go with you. We'll just take a picture of your driver's license. You come back. I didn't need it for an hour. I took my wife, my family. I mean, it was amazing. The first, the Cadillacs back, Escalades back in the day when they were really nice. Well, they still are. So I come back and he didn't have to sell me because, here, you drive it, you find out. And we got the feeling. It was great, even though it's $1,000 a month, for our payment, but it's just different. So what I do is I give the patients 1 or 2 treatments. Like just last week, patient came in, hey, I'm going out of town on Thursday. We're going snowmobiling with a bunch of buddies, and his back is killing him. His lower back's killing him. So, you know what, come in on Tuesday and Wednesday, and let's help you. So he comes in Tuesday and Wednesday, we do some laser, do some spinal decompression, and he's feeling so good. So then he goes on his trip. And then he comes back. So when you come back, we'll meet again. I'll see you next Tuesday for a next appointment. So he comes in yesterday and he said, yeah, here's the program. So I've given him this program. I've given him 2 treatments, and he's felt the difference because he's thinking, if this doesn't work, I'm going to have surgery. And the surgery procedure that he wants isn't covered by his insurance. That's going to be 50 to 60,000. So I tell my program 6,000, for 3 months. And he's like, that's a lot less than what I was going to be spending. And I see a difference here. So now he buys a program. Neuropathy. They come in for neuropathy. I take a picture of their feet before, give them a treatment. That's a Tesla Max. That's where we put the electrodes. And we do another picture right afterward to see if their temperature comes up. Because, I can't accept you as a patient yet because we need to see if it's going to help you. So you want to talk about helping them first. And then when they see the results, when they feel some results, you're like, oh my gosh, I think, I want to do this program. Like some chiropractors, I can't adjust you until you pay me. Give them a freaking adjustment. Give them some therapy. Give them something so they can see that your technique is good. Your technique is going to help them reduce their pain. And then they're going to be, again, raving fans. Hope this is making sense to everyone. Now, people can read you and they want to buy you, not what you do. So you need to be like no other office and roll out the red carpet. Give some samples, some nutrients. We get out samples on the first visit before the next visit, things to help take care of inflammation, pain, herbal things that we have from Solutions for. So we just want to roll out the red carpet and just give them things. Because when you give things to people, they all of a sudden feel like they need to now give you something. But we're just kind of giving them out these samples because who doesn't love going somewhere and getting samples? Oh, these are free. Oh, these are free. Can I get one for my husband? Can I take, of course, here. So we give them these little sample shakes, chocolate or vanilla. They say, here, do you have anybody else in your house that would like to try this? Oh yeah, my son, he loved. So I give him 3 or 4. And you know what? It's marketing. It's another way to market. Then they come in on the next visit. Hey, my son loved that. Can I get one of the canisters for chocolate? He loved the chocolate. Just little things like that to have raving fans. You'll sell more. Now here's another tip. I spent probably $100,000 to figure this out. Hopefully, maybe some of you already do this. So when they come in on their first visit for just any care, you want to write down, this is just an example. You want to write down all the CPT codes. You want to have that written already, and then a description of what they are. And then you call the insurance companies and you ask them, so what do you pay for a 99490? And what do you reimburse on that? Whether the doctor's in network or out of network. How about the 99487? What do you pay on that? So you're going to get a list of all these codes and what they reimburse. So now when they come in for their second visit and they say, I'm feeling better. Okay, Bob, we're going to have to do these therapies on you. And we just found out that your insurance does cover everything we do here in the office. They're going to allow us 4 codes a visit. So we're going to pick the 4 codes that we feel are going to be best for you. And so now he feels comfortable that you've done your due diligence and you've checked to see what the insurance covers. He feels comfortable now that he's not going to be out of pocket. He's not going to get a surprise. Like they're going to do all this therapy and they're going to go, oh, by the way, they didn't cover any of it. No, he's going to say, no, we checked, we verified, you're good, you're covered. It's going to make him feel great. So, okay, let's get started. Let's get going. When's my next visit? All right. What if it's cash? So you want to have some different levels they can choose from. So what you're offering, start out with something lower. So we do some body contouring packages. We do like laser body wraps, ultrasound treatments for inch loss. So I have a 3-visit package, 6-visit, and a 9-visit. And somebody will come up to me and they'll go, well, we'll do a first visit for $95. We're doing that marketing through Proactive. $95 for the first visit. We call them contour leads. And so they come in, we do the first visit, they lose like 2 to 4 inches, which we measure before and after, and we take a picture. And they say, what do you think? How many visits do you think I need? Do I need 9? Do I need 6? So I tell them, you know what? Why don't we just start with 3? Let's start with the 3. And then let's see, and we'll keep measuring. After your 3 visits, we'll take a picture before and after, and then we'll see where you're at. And then you can decide from there. Nobody wants to be sold. How would you feel if I said, oh no, you definitely need 9 visits? Or let's start you with the 3, and then we'll just kind of play it week to week. Every 3 weeks, we'll see where you're at. And then if we need to add more, we can add more. Okay. That's what they want to hear. They don't want to be oversold. And then you want to continue to show, other patient success stories. Like you have the success stories on the wall, when they're going down to you're giving them a value tour, and you stop here at the memorial, stop here at the testimonial, and they look at all these testimonials and they say, now, aren't you here for back pain? Are you here for weight or whatever it may be? Look at these 2. Here's a couple more that had the same thing you did. In fact, we have a before and after picture here of this patient. We have a before and after picture here, and they're like, oh my gosh, yeah, you guys have helped a lot of people, haven't we? Yeah. Then you also want to do a daily support. So we have a coach here. And whether, you have a doctor or a staff person, because some offices don't have a staff person yet. So then the doctors can trade off their phones. You want to have like a 24/7 access. I remember back starting, I used to have this patient. I can't remember her name, but back in 1991, she was an older lady. She was probably like 65, 70. And she would call. I said, hey, you guys can call me anytime you have any questions or any problems, any pain. So she'd call me like 12 or 1 o'clock in the morning. And she's telling me she ran into the garage door. And come to find out, she went out drinking and then she hurt herself and she went calling me because she had pain. But I answered the phone. I said, you can't, why don't you call me when you wake up and you're not drunk anymore, right? So, but that's just, a one-off there. But everybody else loves the fact that if you're helping them with nutrition programs, eating programs, they have a coach here, because you can even take a picture of a product, of a nutrition or a food, and say, hey, is this good for me? Is this on my program? Can I buy this? And then Linda, who's our coach, she'll actually I have a phone for her that she carries with her, and she's always there for everybody, even on the weekends when patients call. And patients love that 24/7. It's like the umbilical cord is still hooked. And then also, you want to continue to impress on each visit. So what we do is we have this thermal imaging camera that we take pictures of their feet, and to really see how bad their the neuropathy is. You can actually see the blue in the toes, and there's a laser pointers in here that you can see. It's like 70 degrees, 80 degrees. It's supposed to be like 95, 98. And then we take those periodically to just check on progression. And then we also have a Tanita scale that measures body fat, body mass, body water, how hydrated or dehydrated they are, and even visceral fat and metabolic age. So we do that actually every week to see the progression, because people want to see the progression of how they're doing, gaining more lean muscle mass, losing more body fat. And it just keeps people excited. So you have this system in place to keep them engaged. And you can even use that camera if you're doing just back pain or neck pain, because it has 3 lasers. So you can put the middle laser of a temperature right on the spinous process, and then one on the right, one on the left, a transverse process to actually see the temperature. And you'll be able to look up and down to see the temperature on the C spine or L spine. And then you take a picture and then you show the patient, yeah, you're not kidding. You got a hot low back, it's like, 3 degrees warmer than all the other areas. And so they start working on them, and maybe once a week or every 2 weeks, take another picture of that area and show them, hey, your back temperature has come down. It's looking really good. So then they feel impressed that what you're doing is helping them. It's just another objective way to show them what you do works. And then again, get testimonials. So I tell my staff every time somebody comes in and they get a good story, record it, take out their phone, record the testimonial from the patient, say, hey, you've been coming in to see Dr. Singleton for now, how long? Three weeks. And now you've just noticed you have more energy, you're sleeping better, and those kind of things. And so that we take the testimonials, and then during staff meeting, we share them, and whoever has the best testimonial wins, like, $25, two movie tickets to a big theater movie. And then you can ask your patients to give you Google reviews. If you're trying to get some good SEO on your website, you got to have some good Google reviews. And so there's ways to set that up so you have the patient do it on their phone. And so I'm sure if you need help with that, you can talk to Angie, right? And so those are the things that really keep you going. In fact, we have a doctor in New York who he's getting crazy Google reviews, and he gets a lot of new leads just from getting good Google reviews from what he does in his office. So you're getting raving fans. And then after they've been in for a minute or two, ask for referrals. Remember, 91% will give referrals if asked. Only 11% ask. So we always have every staff member has a business card. They have a business card with their name on it. Okay, they have a business card with their name on it. So the staff person gives out 5 referral cards and say, hey, especially when they hear something positive, say, well, you know what? Dr. Singleton wanted me to let you know that we do have some room for some new patients that have conditions like you, because people seem to know other people have the same condition. And so you give out the staff referral. And so when the patient comes in, because bring this card in with you, because you're going to get we usually give like a free sample, a nutritional packet kind of a thing. So when they come in and the patient actually buys the program, and the staff member gets like 5% from that sell. I mean, hello, is that cool or is that cool? So then staff are always asking for referrals because the doctors are so busy. They don't always have the time to ask for referrals. And then when they get to a point and you start to get them on maintenance, whether you're coming in once a month for a treatment, every other month or whatever, you get them on a nutritional plan, and then you get them on what's called recurring nutrition. We use that company again called solutions4.com, solutions4.com. And we have it set up so that they can order, because they can't get it anywhere else but through the doctor. And then because they don't buy it through you, guess where they're going to go? Walmart, big #1 supplier of supplements. So they're going to go to Walmart. So you want to be able to have them order through you. And so we have doctors that have recurring revenue of like $5,000 to $15,000 passive income just from patients that they've helped that keeps ordering the nutrients, the products online. We even have a way to send out weekly emails, broadcast media, just to send out educational emails to the patients who are coming in, new patients and old patients. So that's on a whole nother topic we can talk about. Well, thank you for your time and attention. And if you want any more tips, or if you have any questions, I'd love to help you with the flow in your office, what you're doing with Proactive, and together let us solve any issue that you may have, because I've done it all pretty much. It's really fun. That, by the way, that's my daughter. That was about 10 years ago. I lost like 50 pounds since then, but that was in Alaska, fishing, catch a can, salmon, fun stuff. So there's my cell phone. If you have any questions, text me, or work something out with Proactive to set something up to talk to me. My website, my website for local, I mean, what am I trying to say? That's my electronic brochure. So if you want to see the electronic brochure, there it is. And then for coaching, it's my website, singletonsystems.com. So again, if you have any questions, let me know.